We've been talking about heart valves. Now you know the names of lots of them. This is an image from your textbook, and it's a difficult image, so let me walk you past it. To understand this image, you should imagine that there is someone that's actually probably would be a giant laying on their stomach, and their head is where you're sitting, and their feet are back behind you, so that this is their right side, and that is their pulmonary valve, and here's the aortic valve. And what are we looking at? In this image, they've magically cut away the atria. So you can look as if you were standing right here in the atrium looking down into the ventricle. And again, here you're in the left atrium looking down into the left ventricle. So the reason I really wanted to show you this particular image is to discuss with you the coronary arteries. So this is the beginning of the aorta. Just barely on the other side of that closed aortic valve, I would have seen the inside of the left ventricle. But now the blood has come out and then it's going backwards and it closing. And I want you to see that the coronary arteries, this one and this one, they start right at the beginning of the aorta. I look at it this way. The heart says, hey, I'm working so hard to pump this blood. I get first dibs on the blood that's coming out. So the beginning of the coronary arteries is right here at the very beginning of the aorta. So we've got the left coronary artery and then its branches, the right coronary artery and this branches. Remember the cardiac veins, they're going to look blue, and the coronary arteries, they're going to look red. Pulmonary and aortic valves are called semilunar valves. Yeah, okay. And the coronary arteries start at the proximal aorta, the earliest part of the aorta. So now this is a set of slides that explains something in words. And it's funny to me how sometimes when we try to explain something in words, we make it harder to understand. But I want to make this point, that blood will move from here to the ventricle when the atrium, right atrium or left atrium, when that chamber contracts. So when that chamber contracts, it's putting the blood under pressure. And when the blood's under pressure, it pushes open those valves. Remember, the valves are kind of just like double doors, swinging doors that the blood will push open, okay? So when the pressure in the ventricles relax, there's blood in there still a little bit. The blood here is under less pressure than the blood here because the atria are contracting. And so blood goes from where it's under a lot of pressure to where it's under less pressure. The blood is pushing the door open. Interestingly, the blood also pushes those valves shut. When the ventricles start to contract, the atria are relaxing. Now the blood is under more pressure here than there. So the blood wants to go back, but remember the chordae tendineae and the papillary muscles is not going to allow that door to swing back the wrong way, okay? So when the blood pushes on it, it just pushes that door shut. So when the ventricles contract, the AV valves will be pushed shut by the pressure of the blood, and the semilunar valves, here the pulmonary valves, but also the aortic valve, they get pushed open by the pressure of the blood. So it's constantly the contraction of the chamber puts the blood under pressure, and when the blood's under pressure, it pushes the door open, or in the case of the ventricles, pushes one door shut and the other door open. And when the blood is coming in from the atrium into the ventricle, in this case, the left ventricle, then you can see the blood pushes that door open. And when the ventricle contracts and the blood tries to go backwards, it kind of gets caught in these little cups that are a little bit like parachutes. And when those fill up, then it shuts that door behind it. So understand this. Blood moves into a ventricle when the pressure in the ventricle is less than the pressure in the atrium, causing the mitral or the tricuspid valve to open. Okay? Blood moves into the aorta when the pressure in the aorta is less than the pressure in the left ventricle, causing the aortic valve to open and simultaneously slamming shut its atrioventricular valve. Okay. I hope that's really clear. I put it in writing, must be on the exam. All right, let's talk about the cardiac cycle. The cardiac cycle is one complete contraction and relaxation of all four chambers of the heart. And here's how it happens. The atria contract and they fill up the ventricles with blood. The ventricles contract and they squeeze blood out into the major arteries, pulmonary trunk, and the aorta. And then all four chambers relax for a moment. That is known as the quiescent period. And then it happens again. I want you to know these terms, systole and diastole. This looks like systole, doesn't it? Yeah, it's pronounced systole. I'm guessing it's because it's got a Greek derivation. I'm not sure. But systole is our word for the contraction of a chamber of the heart. Diastole is the word for the relaxation of a chamber of the heart. It is correct to say atrial systole happens while the ventricles are in diastole, and the ventricles are in systole while the atria are in diastole, and then all four chambers are in diastole at the same time, and then atrium, ventricle, rest, atrium, ventricle, rest. Now, it's true to say atrial systole or ventricular systole. However, if you're ever reading in a textbook and it simply says systole, they would like you to assume that they are talking about systole of the ventricles. So, systole and diastole and the valves. So, look at how weird and tiny the atria look. That's because they are in systole, they're contracting. And they're contracting so that they can fill the ventricles up with blood. While the atria are in systole, the tricuspid and mitral valves are open. Tricuspid valve gets opened by blood being pushed into the ventricle on that side. Bicuspid gets moved by blood being pushed through that valve on the left side. Good. So that while the atria are in systole, the tricuspid and mitral valves are opened, and the aortic valve and pulmonary valve, they're shut. Then, when the ventricles go into systole, the atria are in diastole, right? And as the ventricles are contracting, they are going to close the tricuspid and close the mitral, but they will open the aortic valve and open the pulmonary valve. And then everyone rests and all the valves are shut, and then it happens again and again. So now we're going to start talking about how your heart works. And in order to know how your heart works, I think all of us think about ECGs. We always think about those little beep, beep, beep. We'll get to that. But the truth is, having your electrical beep, 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 that swell, but that actually doesn't tell us how well your heart is working. In order to know how well your heart is working, we want to know how well does it do its job. Well, if I owned a pump, I would want it to be, if I bought it and it said it could pump 10 gallons per minute, I want it to pump 10 gallons per minute, right? Then I know my pump is working right. If I bought a 10 gallon per minute pump and it's only pumping 5 gallons per minute, my pump ain't working right. So we want to know that about the heart, but how do we test it? Well, if we just cut off your head and measured how much blood came out in a minute, I guess we would know, but you would not like that very much. So here's how we actually do it. We do it using ultrasound. You know, ultrasound, that little device that gets put on a pregnant woman's stomach so that we can see the baby while it's still inside of the mother's uterus? That technology, that ultrasound, can be used to evaluate how well the heart is working. By the way, this guy who's smiling right here, that's his job. He is not a nurse being an ultrasound technician is its own career. And so if you're interested in career in healthcare, but you're kind of double thinking about the whole being a nurse right now, you might think about being an ultrasound technician. Ultrasound technicians can use ultrasound to look at pregnant women's tummies. They can use ultrasound to look at hearts. They can use ultrasound to look at people's gallbladders, all kinds of things. So this technology gets used in a way that I think I will discuss in the next video, so I don't need to interrupt my explanation.